It's a major burden for a lot of people. People need to spend a lot on medication.
Real people are affected by government's decision not to pay for medically necessary medications that are so critical to people's health.
They have to make decisions all the time between the two of them of whose medication they can afford, between he and his wife.
He's on a limited income, and he couldn't really afford the medications that he needed. He was making the choice between spending money on the medications he needs on the one hand and then finding money for healthy, nutritious foods on the other hand.
And a very large proportion of the patients I take care of are admitted to hospital because they aren't taking their medication.
If patients need medications and can't afford them, it actually costs the healthcare system even more.
We were having a hard time getting his blood sugar and his blood pressure under control. Sometimes he would come in and it would be great, and then other times he would come in and it would be terrible, and I was having difficulty figuring out why. And finally we had a frank conversation about his medication, and it turned out actually that he couldn't always take his medication. He could only take it sometimes, and sometimes he wouldn't come to see me for 6 months or more because he wasn't able to afford to take his medicine, and he knew that his numbers would be off, and he was embarrassed.
We can fill the gap from whatever we have lying around in our sample cupboard, but oftentimes that's not the most appropriate therapy.
And the pharmacist just gave it to him for free and said to him, "Don't worry about it, I'll write it off. I'll say I dropped it on the floor."
One of the things that we have to remember as Canadians is our responsibility to each other.
Part of Canadian Doctors for Medicare's work is to help ensure that people have access to healthcare based on their need,
not ability to pay. And that fundamental notion of equity is what underpins Medicare and underpins the design of our entire system. But at the time that the system was designed, medication and coverage for medications was not as big an issue as it is today. Now we understand that a critical part of managing illness in modern medicine includes the use of medications. And it's time to apply that basic principle of fairness, access to care based on need rather than ability to pay, not just to doctors and hospitals, but access to essential life-saving medications as well.